first heard about this and began this about 10 years ago, this is the 11th year anniversary of Citizens United, I was very, I would tell people about this and they thought, well, corporations need rights too. And I agree with that. I've got two little minor corporations, but we should be telling them what their rights are, not the other way around. And as you'll hear from our speakers today, and I'm sure many other examples that you can call upon, that's not what's happening. The corporations are telling us what we can do. That's not democracy. So that's what we're working on. If you have interest in finding out more about what we're doing, I recommend that you go to, I highly encourage you to go to the movetoamend.org website, check out what we're doing. You can sign up. We don't send a lot of emails, but what we do when people sign up is it gives us more options to, when we speak to our representatives, we say, hey, these are your constituents talking. You need to pay attention to them, and they do. So that's Move to Amend. We'll be talking about these different topics, which also exhibit how corporations are running the show, or at least trying to, but we're going to stop them. Our guests this morning are Deb Silverstein from Ohio Single Payer Action Network, or SPAN, if you're familiar with that, and Marky Miller will be a champion of rights of nature in Toledo. So more on them in a moment. I just want to go through some of the housekeeping. One is, if you're not speaking, please mute yourself. Sometimes there's background information that background noise that we're not even aware of. So please mute yourself if you haven't been already. The format today will be Deb Silverstein will be our first speaker. She'll have a 20-minute presentation or thereabouts, and that will leave us 15 minutes for questions and answers, comments, those kind of things. Please, everyone, if you can keep your questions on tack, maybe write them out in advance. However, let's have as many questions as we possibly can. You can always talk to people about larger issues afterwards. Then our next speaker, of course, will be Marky Miller. Same thing, 20-minute presentation or thereabouts, and 15 minutes Q&A. And then we'll have a 10-minute wrap-up at about 11:20. So that's what we have lined up. And we welcome a lot of participation from everyone. So our chat, again, please put your questions in the chat. If you are reaching us by phone, all you need to do is press star, I have it right down here, *9, if you're on the phone and you want to speak, and then we'll see that. There's two people working with the questions, and that is Dave Lima, and he'll watch you, people who are raising their hands on the sidebar. If you have a question, you can do it two ways. You can raise your hand. By doing that, just check the participants little icon at the bottom of the screen. Look for participants, and you'll see a little spot where you can raise your hands. You might want to check more, and there's a spot where you can raise your hands. Yeah, and then, or you can put your question in the chat, and from time to time, I'll be asking Mary Sue, who will be monitoring the chat, and Dave Lima, who will be looking at the hand raising for questions. And of course, if you have if you have a question, just go on with *9. And Mary Sue and Dave, if you can remind me if I'm not seeing something, please remind me. Just check back in. Again, in the chat, feel free to add any comments or questions, or even other events that are coming up in other organizations that you're part of or know about. Okay, any questions before we move into our presentations?
Just an announcement. I'm going to mute everyone just in case. And so those of you who are speakers can unmute yourself.
Okay, so thank you for that, Greg. And our first speaker is Deb Silverstein. And Deb all Once enacted, this comprehensive plan will provide far better care for far less cost, while also providing jobs and training during the transition. So any questions you have about this? I've heard Deb speak before, they have the answers for them. This is very well thought out plan. So welcome, Deb, and take it away.
Thank you. And I'm going to be sharing some slides with you. So can everyone see the screen where I've got the SPAN logo up? Okay. This is our logo, and this is a description of what SPAN is, Single Payer Action Network. And yes, we're working to achieve fundamental reform of the health insurance system. We're nonpartisan and we're nonprofit. We're a 501c4. So let's see. I have to get out of the, there we go. Oops. All right, we gotta try this again. Okay. There. Fear the status quo, not the change. The status quo is woefully inadequate in most instances. We need fundamental change to our entire system. I think that COVID has pointed out to us how corrupt our system is, and especially with the lack of leadership that we have at the federal level. So let's not fear change, let's fear the status quo. Why do we still need health reform? We did that, we had the ACA. Why do we still need to do more? And it's basically number one, even with the ACA, the costs are out of control and outcomes are mediocre. And that's mainly because people don't have access to health care. Even with insurance, high deductibles and copays are discouraging a lot of people from being able to access care. And we're also seeing that services and resources are moving out of low income, low wealth areas and moving to the wealthy suburbs because it's more lucrative, for them to chase the dollars there. I think something that we need to take a close look at is that despite the ACA, we still had 28 million uninsured. We had at least double that were underinsured, which meant that their deductibles and copays were so high that their insurance really did them no good. Most of them would avoid seeking care. 5.4 million have lost insurance since the pandemic started. That's a low estimate. It could easily be higher than that. And that is really an indication of why we need to stop bundling health insurance with jobs, because now in a pandemic is when people need insurance and they need healthcare access the most, and they're losing it. So meet Alice. Alice is a report that was prepared by the Ohio United Way, and it's really quite interesting. They looked at asset limited income constrained employed people. That's what Alice stands for. Now, when we look at the poverty levels that exist that are determined, those poverty levels are artificially low. You need a lot more to be able to just survive than poverty level incomes. So Alice looked at that and determined that we have over 1 million households that are existing below the survival level and so we need an hourly wage of $15.10 for 2 adults to live there. 43% of Americans are poor or low wealth. This is something that the Poor People's Campaign is really taking a look at and hitting their low wealth. It's not just those that live below the poverty line. And we're rapidly reaching the 50% or more mark, especially with the pandemic, and which really puts us into third world nation status. Our system works very well for the rich. It doesn't work for the rest of us. So what does Alice do when she's sick? She skips healthcare, rations, medications. We know about rationing insulin. We know that kills people. The cheap insurance with high deductibles and skimpy benefits, these are the Trump plans that he allowed, and people are finding out that it does not cover what they need at all. So again, a lacking in our healthcare system for those who probably need it the most. So the brief history, the thing that's important here is that we have been trying to reform this system since 1912, and it's time for us to finally get the job done. You know, we keep being told, well, now's not the time, now's not the time, now's not the time. Yeah, it is. It's past time. Now's not the time is an excuse that people are using. So we did have some changes that took place, but they were not sufficient to really make the system work. And in fact, some of them really worked against us. The PPACA, the ACA, what it did is it did eliminate some insurance company abuses. It did not reduce the administrative jungle that exists there, and that's where most of our money goes, is into administration. And it did not really fix the marketplace. Most of the gains that we made under the ACA were due to the Medicaid expansion, not because people could afford insurance. So we now have the Senate Bill 1129 and House Resolution 1384 that have been introduced in this session of Congress. And these are the Medicare for All Acts of 2019. And this is what we are supporting at the national level. And at the state level, we have House Bill 292 that would do the same thing. And Trump, of course, is trying to have the Supreme Court rule the ACA is unconstitutional, and he wants to replace it, but he's never been able to come up with what. So we've got, you know, the post-Obamacare reform. Remember when we had the House voting 54 times to repeal the ACA, and that, but there was never anything to replace it with. And so the cartoon says, did you do that term paper? We've had 7 years to write. And the guy says, well, I'll do it on the bus. You know, which is what they're doing and hurting us. So the questions we want to ask is, what is the purpose of a healthcare system? Why do we have a healthcare system? And why do we have private corporations? And do the two of these work together to our benefit? Now a healthcare system is really meant to take care of our healthcare needs, to protect our health and to take care of us when we're sick. Private corporations are in business to make money. How does that work with a healthcare system? Not well. In fact, not at all. This is what we get. This is where your money goes. Look at that Mark Bertolini from Aetna, and this is a couple years old. Of course, if I were the Humana and the Anthem guys, I'd be feeling like the poor relations here. It's like, why don't I get this much? But this is criminal. But that's not all. This is not all where your dollars go. They also pay for a lot of lobbying. And the healthcare industry and big pharma do a tremendous amount of lobbying, taking your dollars and working against you. In the lobbying efforts for the ACA and trying to lobby against it, that was the most expensive lobbying campaign that has ever taken place. Your premium dollars at work, and this is why you're paying the big bucks for your medications. You know, so the campaign donations after Citizens United, $6.2 billion by the 5 largest insurers. And Sherrod Brown got some of that too. So, you know, even the people that we consider the good guys are getting benefits out of the lobbying. And interesting to note, Sherrod has not signed on as a co-sponsor of the single payer bill in the Senate. So, but we're really happy to give tax cuts. And what do we want to use to pay for those tax cuts for the wealthy? We want to take away, we want to Medicare, and we want to cut down on what we're providing to people that need it, Medicaid. Don't feel too bad for the drug companies if we were to get a single payer plan, because, you know, they're telling us that they're spending, the prices are high because of research and development. And you can see that's only 13% of their costs. Marketing and administration is 35%. The marketing means all those television ads that you see, telling you to ask your provider to write a script for this medication, which is probably sky high in cost. And that, but research and development, keep in mind that most initial research takes place on the taxpayer dime. Right now, we are paying billions of dollars to come up with a vaccine for COVID, which some company will then take over, patent, and make a tremendous amount of money on. Have you seen the information about remdesivir, which is a medication that can help people with COVID to have a shorter time period, get out of the hospital sooner, and have better results. That one was developed with taxpayer money, and they want to charge the government healthcare agencies $2,000 a treatment and private insurance $3,000 a treatment. So that's criminal when we paid to develop that drug and it only costs $10 to produce it. Drug companies, even in bad times, outperform Fortune 500 companies. These are drug company profits in red and Fortune 500 in yellow. So I'm not the least bit concerned about drug companies. They will survive quite nicely. In fact, better than they deserve to survive. This is another issue because of our complex system, and the complexity in our system is just amazing. The average physician spends 8.7 hours, and some cases say 20 hours, up to 20 hours per week on administrative tasks like billing and pre-authorization and appeals and that sort of thing. At one time, Duke University Hospital had 900 beds and 1,300 billing clerks. Now you can be sure they didn't have 1,300 nurses to take care of their patients, but it took 1,300 billing clerks to make sure that they billed the insurances. Now, a comparable size hospital in Canada might have 4 billing clerks. And this is one of the things that we're seeing, this phenomenon where the growth of physicians and administrators has greatly outpaced the growth of physicians that we see here in yellow. And the growth of nurses mirrors the growth of physicians, and compare that to administration, which is, just mind-boggling and is strangling the whole system. And as we do that, we spend more and more on that, and what we're doing is we're strangling other sectors of the economy because so much of our economy is going into the cost of healthcare. So this is a cartoon that came out. This is Obamacare, where you can navigate through, and if you can figure out how to get through this, then congratulations down here at the bottom, you're insured. Now notice we cut out single payer in our discussions, which would have been direct from, okay, you're here in the US, you've got healthcare, you're insured. Now we're going to compare that with the GOP plan and some Democrats too, and they have a very simple plan: get sick, die penniless. So we've been hearing more, we kept trying to repeal the ACA and replace it with something, although no one ever came up with that. And then there was another attempt to do that right after Trump got elected that John McCain kind of foiled. And the cartoon is, can we pledge to repeal and replace our repeal and replace pledge with a replacement that repeals replacing our earlier pledge to repeal? And that's kind of where we're at. Nobody knows what they're doing. So what does single payer mean? It's really a financing mechanism for healthcare. And it refers to a single pool of money from which one entity pays the medical bills. Providers and hospitals are free to continue as independent businesses. The government would not take those over. There are some that are government owned, like the VA. Those would continue to be that way. But for the most part, most of them are privately owned or maybe community owned in that. So this is a kind of a diagram of what we do now. This is a very simplified diagram of what we do now, but we're paying out in very numerous different ways. We pay taxes, we pay premiums, we pay for it in the price of goods and services and that type of thing. So again, it's a complicated system. In a single payer universal healthcare system, it would, all of us would pay into the one plan, and that one plan would pay out to the providers. And that one plan then now has huge market power, in negotiating costs of not just the drugs, but also physician costs, hospital costs, and so forth. And that's one of the problems that we have, is no one really has that market power to really control the cost. Consumers Union did some research, and they said the real drivers of healthcare are not old age. It's not because people smoke. It's not because people drink. It's not because people are fat. It's because of who's got the market power. So what do? We educate the public. We initially tried to get single payer on the ballot, but when we passed the Ohio Healthcare Freedom Amendment, that made the original ballot initiative impossible. We passed this Freedom Amendment in 2011. People didn't really know what it was, but it really says that the state of Ohio can't do anything in the healthcare field. Now, most of the time they're ignoring it, but this is going to be an issue that we're going to have to look into in order to get it passed here in Ohio. We worked to get the bills introduced in the House and Senate. We've never gotten past the introductory stage until last session, where we were able to get proponent testimony on House Bill 440. We had Senate Bill 91 that was in the Senate at that time. These bills have been reintroduced. We now have House Bill 292. We have not reintroduced in the Senate as of yet. So what do we offer? Basically comprehensive coverage, no copays, no deductibles. That's called first dollar coverage. And that anything medically necessary, dental, vision, mental health, hearing, and the things that go along with that. So it's basically a real comprehensive plan. There should be no out-of-pocket expenses unless we're talking about cosmetic surgeries. If we can do all that, we can actually save a lot of money. We did a comprehensive economic impact study and showed that we could save about $25 billion in Ohio alone by enacting the bills that we have in the Ohio legislature. And a large part of that, this is provider administration, $10,037 million. So a huge part of it is in provider administration. That means hospitals with their billing departments and doctors' offices. It costs the average physician about $84,000 to collect their fees, so which is more than what most of us make in that. So there's a lot of different ways that we can save money on this because we've streamlined it and we've cut out the middlemen. We can reduce waste and negotiate reasonable drug prices because of the market power that we would have. If we could do save just 37% on drug prices, that's $6 billion in savings for drugs and $800 million in medical equipment. We can reduce waste and regulate hospital monopolies. You know, basically hospital monopolies, it doesn't mean that they're more efficient in doing it. It means that they've got the market power and they can raise their rates. And generally that's what we see, are higher costs in areas where we have market monopolies, hospital monopolies. Thinking of Cleveland with university hospitals and Cleveland Clinic, Metro Health really doesn't compete that well with them. You got to be careful with the monopoly pricing and that type of thing, because even nonprofits, you can see, make a large amount of profit and stuff. There is one thing we do want to watch out for, is if we just have one customer, which we set the price too low, then the supply may fall. And this is something that we know about, and this is something that we need to be on the lookout for in a single payer system, and make sure that we don't do that. Now, one of the things is we do favor global budgeting, which is negotiated based on prior year actual costs, not on markups. And this would be for hospitals and facilities like that. They would have to submit a budget, and they would get their cost of operation costs that would be sent to them on a monthly basis rather than a fee for service. So how do we pay for the Ohio one? We already have $75 billion there in existing sources from Medicare, Medicaid, CHIP, and so on. We would have to raise $40 billion more in state taxes to expand those benefits and the coverage to all Ohioans. But the thing is that $40 billion would replace the $65 billion in out-of-pocket costs that we're already paying, which we call private taxes, because it's collected in the forms of premiums, copays, deductibles, co-insurance, and non-covered expenses. So I think it's a deal if we get rid of the $65 billion that we're paying out of pocket and replace it with only $40 billion that we would collect in taxes based on ability to pay. So what we want to understand is that we're paying for it all anyways. So we need to decide how we want to do it. Do we want to do it in an efficient manner, or do we want to continue to do it in an inefficient manner and pay more for it? I like this guy because out of one pocket, we could do single payer and it would be all taxes based on income and ability to pay. But for some reason, we've been conditioned to think that the current system is better. It's better to take more money out of this pocket because it's not all taxes than to take money out of the other, a lesser amount out of the other pocket and call it tax. The thing we need to remember is we're already paying taxes for 2/3 of our healthcare system. It's just that most of us, like you and me, aren't included in that 2/3 and who gets it. So first, let's test your reflexes. And this is, you know, there was a Senate health plan that was going to raid Medicaid, Medicare, and stuff. So our plan would be security for retirees, because employers, you know, constantly when there are bankruptcies and reorganizations, one of the things that goes is retiree healthcare benefits. Courts have been backing that up, and then retirees are totally on their own at a time when they're living on less money and need healthcare more than what they did when they were young and healthy. It's a benefit for labor unions. It's the most fought over benefit, and this would allow them to concentrate on other meaningful issues like wages, pensions, vacations, and safety. And we can see that, and we know this comes from evidence that we've looked at in other countries and other places that have enacted universal health care. This is the cost, the percent of gross domestic product, comparing the US and Canada after they implemented their universal healthcare system. So the roadmap, expect delays unless we can, unless you guys are successful at what you're doing. So instead of asking why don't they do something, the question is, what can I do to make a difference? And you know, we don't want to really be fulfilling this. You can always count on Americans to do the right thing after they've tried everything else. We want to get active, and we want to do the right thing now. So join Move to Amend and work on this constitutional amendment so that we have the bigger voice in what goes on in government. You can come to SPAN meetings and lobby days. You can support, it's HR 1384 in the House and Senate Bill 1129 in the Senate at the federal level. Write letters to your elected officials. Register voters and get them to the polls. Write some more letters to your elected officials. Educate yourself. Write more letters to your elected officials, and support House Bill 292 at the Ohio level. And you can educate yourself at spanohio.org and pnhp.org, which is Physicians for a National Health Program. And
Okay. Thank you very much, Deb. Really appreciate that. Now it's time to move into questions and answers. I've set my phone, so you'll probably hear it ring when it's 10:45, because that's when we'll go on to our next presenter. Questions. I see some, go ahead.
Yeah, so this is Mary Sue. Deb, somebody did ask if you're going to share the slides. I wanted to let everyone know that we're recording this, but will we also be able to send out that PowerPoint?
I can send it to you and you can send it out, yeah.
Okay. And then we do have several questions. Greg asks, please comment, Deb, on Trump's proposal to reduce the payroll tax in the next stimulus bill as it relates to Medicare.
Well, of course, that would underfund Medicare and it would hurt Social Security as well, because that's the payroll tax that he's talking about, is what you're paying for Social Security and Medicare. It's not going to help anyone that's lost their job because they're not paying any payroll tax, so that's ludicrous. And the ones that are going to be benefiting the most from it are going to be the people at the upper income levels, because they're the ones that are paying more and stuff. So this is not anything that is going to be a stimulus to the economy. If you want to stimulate the economy, you start at the lower levels and you put money in the hands of people that will spend it, and you don't do it by destroying the two social safety net programs we have that are the most successful, and that's Medicaid and Medicare and Social Security. You know, so that's I hope a non-starter in the House in that, but you know, we'll see, and we've got to be vigilant on that one and make sure that we let our elected officials know that that's not acceptable.
Okay, other questions? You can raise your hand on the side on the participants or put something in the chat.
So there are more in the chat. Dave, do you have any hands?
No hands so far.
Okay, so Michael Kokonis just wanted to comment. I'm concerned too at the replenishment of both Social Security, Medicare due to the triple issues of fewer younger people paying in. Those paying in have lower wages overall, and of course our current unemployment, underemployment of people wanting to work in workforce. Of course, no issue if we defunded the Pentagon and quite a number of other entities.
We overfund the things that, you know, like the Pentagon. We don't need to be funding them at that level. We can easily take some money from that. I think it was Alex Lawson from Social Security Works that said if we negated one Pentagon contract, we could shore up Social Security and it would go on forever, you know, and that type of thing. So that's, you know, how ludicrous our whole system is. The money that we are allocating and where we're allocating it is not anything that's helpful to the people. And according to the Constitution, Congress is supposed to act in the general welfare of the people. It doesn't say the general welfare of the Pentagon, of the people. And they're not fulfilling their responsibilities under the Constitution by that. And I kind of think healthcare and Social Security are general welfare things, don't you?
Absolutely. Okay, we have.
Oh, there was a question from Greg about the status of the federal legislation during the pandemic. And that's a good question. Right now, you know, for people that have lost their insurance, the Democrats seem to want to provide subsidies to purchase their employer insurance through COBRA. Well, that's a very expensive program. That's another handout to for-profit insurance companies so that the CEOs can become even richer and they can do more benefits, more dividends to their Wall Street investors and that. And generally, those policies are inadequate because they're part of the policies with the high deductibles, high copays. And if you're out of work, you can't afford the high deductibles and high copays. There is an alternative. Pramila Jayapal and Bernie Sanders have introduced companion bills into the House and Senate called the Healthcare Emergency Guarantee Act. And what it would do is for anyone that's uninsured, whether they lost a job or they just don't get insurance through their job, Medicare would be extended to them with no copays, no co-insurance, no deductibles. And it would cover all of their bills during the pandemic. For those with insurance, Medicare would cover all of their out-of-pocket expenses for the continuation of the pandemic. You know, when the pandemic is over, and that would end. But there is some brilliance behind that, because how do you give that to people and then take it away? People will have had experience with that, and they won't want to lose it. And so it drives up the support among the people for a Medicare for All single payer plan.
Okay.
I had a question. It's not in the chat. I just jotted it down. And you talked about healthcare systems favoring, you know, rich sections of town, the rich neighborhoods. We've seen that in Dayton, where the only hospital in the poorest section of town has been demolished with an easement on it, so it cannot be replaced with another hospital when the land is sold. And this is from a nonprofit healthcare system. So is there any way, short of our constitutional amendment, to really go after these nonprofits that are not meeting their mission of care of, you know, health care for everyone?
You know, I think most of the single payer bills that I've seen, and certainly the ones that are at the federal level and are here in Ohio, would limit that kind of activity. It would prohibit, first of all, for-profit hospitals. And as Jerry Friedman, an economist from the University of Massachusetts, Amherst, said, you have to understand the difference between for-profit and nonprofit hospitals. The difference is nonprofit does not get taxed. Otherwise, they operate the exact same way. And so this would, I think we need to go back to certificates of need and that type of thing. Canada did see, when they enacted their single payer program, they did see healthcare services moving into those underserved poorer areas, away from the richer ones that were overpopulated with it, and moving into some of those underserved areas. And the reason is because there was money to pay for their services now and stuff. Medicine will always chase the money, but one thing that you can do, and this would be a benefit for some of our rural hospitals and keep them from closing up. If they got that money, that operating money on a monthly basis, it would shore them up and they wouldn't be as tenuous as far as being able to continue to operate. That's where a big concern is with rural hospitals. Some people have to drive an hour. And if you're having a massive heart attack and the nearest hospital that can treat you is an hour or an hour and a half away, your chances of survival are much less than the person that lives close to a major hospital. So those are some of our concerns that we would have.
Yeah, I think I would like to just confirm what Debbie is saying. The Cleveland Clinic is moving out to Mentor in Lake County and will be building a hospital here to be completed in the fall of 2021, certainly chasing the money.
Mm-hmm.
Okay.
Yeah, and we saw that in Lakewood too, when the Cleveland Clinic closed down Lakewood Hospital and moved the operation. They replaced it with a little clinic type of thing, but then they moved out to Avon. We also saw it when they closed the Huron Road Hospital, which was what served a lot of the poorer sections of Cleveland. And so, they're not looking at this. These are not lucrative patients for them. And so we want to go out to where the money is.
Okay, we just have about a minute or two. Deb, I'm going to combine a question by Greg and myself for you. With the pandemic, how has this changed? Greg was asking about legislation during the pandemic. Of course, I'm asking you this question with 1 minute left to answer. But the legislation, but also, have you seen an uptick in interest in SPAN since this crisis?
Oh, absolutely. As people have been losing their insurance, and they're saying, this is wrong to really be linking insurance and employment together, because in a pandemic like this, I lose my job, I lose my insurance. And this is when I need my healthcare coverage the most. What if I get sick? And that we've, huge issues, with that. And people are starting to see the folly of the way we do things. Nationally, yes, we have seen an uptick in interest, and in the state of Ohio as well. We've had good response to some of the programming that we've been running, better response than what we've had in the past. So I'm enthused with that. I think people are really seeing the need for change. And I'm hoping that out of this, we can really work towards systemic change in a lot of our issues. We've got a lot of economic policies that need to be changed so that people that are working can actually earn a living wage. We need to, these are all things that affect health, and we need to work on the systemic changes there. And that's environment, that's housing, that's nutrition, that's living wages, the whole shebang. So we need fundamental systemic change all over.
Excellent. Thank you so much. That was so informative. I don't know how you pack so much into this time. So I really appreciate it. I think we all do. If you're interested in learning more about SPAN or joining it, span.org, easy to find. And Deb, I think, has some things in the chat that you can look at as well if you want to get hold of her directly. And contact Move to Mend, if well, we can always put you in touch with her. But this is so crucial.
Well, one thing I would, I put a link in there, and I'd like to invite everybody to join us tomorrow night. We will have Ivanka Hall from the Northeast Ohio Black Health Coalition talking about racism in healthcare. Does it exist? How do we fix it? And what are the effects, and the history of it and stuff. And she's an excellent speaker on this topic. So registration is required. You can go to our webpage and follow the link there to register, or I listed it in the chat right at the beginning.
Yeah, please, definitely recommend it. I haven't been to any SPAN meetings that have not just blown me away each and every time, even though I know some of it. So our next one, and they're so related, because Marky Miller is going to be talking about protecting our environment, which of course, who gets most, who's affected most in a negative way by the environmental toxins in our environment, are the people who need insurance and can't get it. So the connections are just undeniable. So Marky Miller is part of the communication team for CELDEF, which is the Community Environmental Legal Defense Fund, so CELDEF. In 2014, nearly 500 people in and around Toledo lost access to clean and safe drinking water for 3 days due to a toxic algae bloom in the western basin of Lake Erie. This proved the catalyst for her work and passion for the rights of nature and community rights movements. She quickly became a lead organizer and spokesperson for Toledoans for Safe Water. So that's her group now, Toledo's for Safe Water. She played a crucial role in the Lake Erie Bill of Rights, a local law recognizing the legal right of Lake Erie to exist, flourish, and thrive. The first one in the country, by the way, and it got more international attention at first than it did get national attention. Wonder why. Markey is a volunteer board member of the Ohio National Community Rights Networks, working to advance the right to self-governance and the rights of nature at the state and federal level. Right to self-governance and the rights of nature. So, Mark, take it away.
Thank you. Thank you so much. I'm really happy to be part of this gathering, and I'm so sorry that we couldn't do it in person, but I'm glad we found a way to make it work. So yeah, I'm a volunteer organizer with Toledoans for Safe Water behind the Lake Erie Bill of Rights. Definitely would not call myself an expert on any of these issues. These are things that I learned out of pure necessity because, you know, we were really backed into a corner and realized that no one was coming to save us. So these were things that we really had to come together and figure out. So I want to talk about a little bit the story of LEBOR, or Lake Erie Bill of Rights. I'll probably refer to it as LEBOR throughout the presentation. But also I want to frame this in how a community loses its voice, and more importantly, how we can gain that back. So let's jump right in to the lovely green waters of Lake Erie. These are pictures from pretty much 2014 to now. This is actually how it looks right now today, and this is how it looks annually. We kind of have this problem all the time now, and in 2014 we did experience the do not touch, do not bathe, do not drink, do not boil order from this toxic algal bloom of cyanobacteria or blue-green algae. And this affected 500,000 people. So it was the Toledo, but then surrounding communities in Michigan and other areas as well. So, you know, this was really a time of witnessing our own vulnerability. And we woke up in the morning, the alert went out at 2 a.m. A lot of people who, if you didn't have access to information, to technology, or you weren't up at 2 in the morning, you didn't know that this was even going on. So it was just one day woke up to a waterless world. And, you know, because of COVID, I usually have to explain the panic and the chaos of those 3 days that we experienced. But because of COVID, that's a little bit more universal now. I don't have to talk about the shock of empty shelves, of long lines at the store, of panic buying, scarcity of supplies, right? We've all kind of gone through this now. But I do want to point out just how scary this would have been to experience along with something like COVID, where the message is wash your hands and, you know, stay home, stay healthy. We had to stay home, but if you stay home without being able to turn on your tap water, you can't bathe, you can't do laundry, you can't do yard work. I mean, everything gets affected. You literally just have to sit there. So it's very scary to think that these two situations could have happened at the same time. But water wasn't the only thing that went missing. It was also all the produce that got thrown away because it had been sprayed with water, frozen food, plastic and paper products, anything to cut down on our need to use water to clean things. So we started to normalize this very quickly. And everything I'm talking about is really the physical representation of what was going on. But we came to learn how vulnerable we really were. And the more we tried to speak up, the more we tried to get answers, the more we were silenced and pushed down. So the response from the city was really, don't worry, next time we'll be ready. We'll have more chemicals on hand. We'll be able to notify you a little bit earlier. We'll make sure that we give you all the information you need to predict when this is going to come again. And your job is just to have a lot of water on hand and be ready for this next time. So, you know, the city started to host some public meetings on the issue. And right away, I saw how censored those were. We weren't allowed to ask about what caused this problem. We weren't allowed to talk about anything other than treating the water and moving forward. And I really just, I didn't want to be resilient to this problem. I wanted to fix it. I wanted to see actual systemic change happen. So I left those meetings. I started going to citizen-led meetings, and it kind of ran into the same thing though, where the passion was there, the discussion was there, but we were left with using the tools that we were given and walking the path that we were given. So put pressure on elected officials, put pressure on the EPA. And the funny thing is, you start to realize, well, wait, they've been in charge of this whole time. And this problem, this water crisis, has been going on. It just never hit our tap water. So that started to outrage a lot of people, that why are we just now dealing with this when it's an inconvenience to us now. So what really turned it around for me was this realization through conversations I had with CELDF and people working in the community, that the system was fixed and we need to break it. And it's this perspective that makes you realize, it eliminates that illusion that all that's missing is information, that if they only had the right understanding, if they only had the research and the data, then they'd be able to make better and more informed decisions. But then you realize that it is working just fine. Everything is working perfectly well for the people who created it, and it's certainly not intended to work well for us or for nature. So we decided to turn to community rights organizing. And community rights is this paradigm shift that empowers local decision making. So currently, we don't have the right to say no to corporate projects or harmful activities, anything that comes into our area, especially if they have a permit to do so, if they have the right to do so. And through this movement, communities are working to create structural changes in law and governance so that everything is done by the people for the people. And so we can think of community rights sort of as this equation that it really doesn't matter what your single harm is. That's not the variable that's going to alter the outcome. And if we keep approaching single issues, we don't get that structural change. We end up spending a lot of time and money and energy, all our resources on fighting this one project coming in, and it doesn't allow us to prevent it from continuing down the road. So we make this realization again that we need to confront the barriers that have rendered us silenced. And this is a graphic from CELDF called the Box of Allowable Activism. And it's meant to highlight what those barriers are, what are the walls that we run into that kind of keep us confined and prevent us from making structural change. The first, of course, being state preemption, that when local decision-making threatens the state and their actions, and when they feel like their power is going to be jeopardized or taken away, they pass a law that strips us of our rights. We see this with banning a ban on single-use plastics, right? You're not allowed to say that that's not something you want in your community. Controlling the minimum wage and not allowing you to make that higher than what the state sets. And also preventing you from denying unethical business practices, right? You can't say you don't want puppies from puppy mills sold in your community. So you see the state implementing these rules and these laws. And of course, they're being written by the corporate actors and the corporate interest that pretty much dictate our state government. And so we see this with corporate privilege and corporate rights. And these constitutional rights reign supreme over the right of people and over the rights of nature and ecosystems. And then that wall to the side there, nature is property. Rights of nature is a legal framework that tries to bolster ecosystems as rights-bearing entities. And in our current structure of law, we understand nature only as property. And when you have that set up, you perpetuate this idea of ownership over stewardship. And that fourth wall, regulatory fallacy, this is a really big one for this story, just because a lot of us who've lived here a long time, we have that memory of what happened to the lake in the 70s, right? People know the stories of it. It got really sick. The lake died. We kind of personified the lake at that time. And we saw things like the Clean Water Act and the EPA come out of that, and things got better. So there's this blind trust that the regulatory agencies are there to protect the environment. And what's happened is that over time, we've been more aware of how it's watered down, how it's been kind of cut up, and what looks like regulation is actually a permit. It's a permitting process to say we've legalized the harm. We are now going to allow it to occur at a regulated rate. So it's really hard to break people from that, especially in this area, because we have a lot of memory associated with the lake getting better. But we don't see that anymore. And so the best way to look at these barriers, you know, we can say, well, we can do what they're telling us we're allowed to do, or we can confront them head on. And that is what we did with the Lake Erie Bill of Rights. So with the support of CELDF, we got together, we wrote the charter amendment, and we recognized the rights of Lake Erie, rights that had long been ignored, her right to exist, flourish, and thrive. And I like to make that distinction that we're recognizing rights, because I don't like this idea of rights that we have created and that we are giving out. It really needs to be, we've fallen short, and we need to admit that we've fallen short, and we need to help bestow those rights further and recognize them, and not just create them out of nothing. And what our initiative does is it gives legal standing to Lake Erie and allows the people here to be the trustees of the lake and act before the harm happens. So much of our environmental makeup with our laws and our actions can only be enacted after we've faced some kind of harm. So we wanted to be able to say, you know, no, we don't want to be burdened with this. We don't want to ask for cleanup. We want to be able to say no. We want to be able to say we don't want X, Y, and Z to cause problems for our water, which is going to cause problems down the road for everything else, for businesses, for communities, for our health. All of these things are tied to the water. I'll go through the timeline a little quickly. I don't want to spend too much time on every detail because it is a lengthy story with lots of ups and downs. But you know, in order to do all of this, we had to collect 10,500 signatures. And we were a small group, maybe 10 people to start, of volunteers who got together on the weekends, on our lunch breaks, anytime we could find. If there was an event going on downtown or in one of our neighborhoods, we weren't there to have fun. We were there to get signatures. You can see our stack of petitions there. It was a long process, and for such a unique group, you know, you don't see a lot of groups that are mostly young people the way that we were, because we had children to raise. We were in school. We were working multiple jobs. We didn't know if in a week or two we would still have our job or have healthcare or have transportation. I mean, there were all these uncertainties that weighed on us. And in the meantime, we're out there trying to get these signatures and raise awareness about this issue. So petitioning is a grind on its own, but when you add all that stress in, you really become connected to this work. So you can imagine then when the Board of Elections kept us off the ballot, how pretty outraged we were. They tried to make the argument that based on content, we didn't have the authority to do this, and we did not have the right to put this issue before the voters to amend our own city charter. So we took them to the Ohio Supreme Court. And that is where we got our first taste of really corporate influence. And it was interesting because we had been relatively quiet about what we were doing, so as to try and not alert too much of the opposition ahead of time, which looking back is a little foolish, but you know, we were very new to this, so we didn't really grasp the reach that they would have. So in that first lawsuit, this is the list of corporate interests that filed an amicus brief against us, against our right to put something on the ballot. And they filed this in favor of what the Board of Elections had done in keeping us off. So I like to point this out because we were just this small local group, and we've caught the attention of all of these powerful, or at least what we associate power to, organizations. And it was validating in a way, although it was a little scary because you realize how much resource is really up against you. So we actually did lose that first court case, but not based on the question of what the content of our law was. It was solely based on what is really the right action for the Board of Elections to have in a case like this. Are they allowed to do this or not? And the ruling came back was, we don't know. We can't decide, and we need to decide, but we're not going to do that today. And luckily, 2 weeks later, a similar ballot challenge came through because there was another group in Toledo that liked what we were doing, copied our language and our tactics, and created this similar charter amendment petition for a zoning issue. And they were kept off the ballot as well, based on all the similarities between our petitions. They went through the Supreme Court, and they also lost, but a ruling came out that said, yeah, we've made a decision, and a local board of elections does not have the right to keep something off the ballot, a citizen's initiative off the ballot, based on content. Your role is strictly administerial. And after working with city council, they did a vote. They gave permission to this group to be on a special ballot in February. And we've said, well, we want that too. It took us 2 months to get that from city council though. And so we were protesting outside their meetings. We protested inside their meetings, and finally just said, you weren't elected to uphold your own opinion. You were elected to uphold the rights of this community and protect the interest of this community and the people that you represent. If you don't like it, you can vote no in February like everyone else, but you can't deny us that right. And we did end up getting a unanimous vote for going to the February election from city council. And I'll skip some of this just to move things along. We were challenged again. It was never ending. But we kind of weren't really involved in that as much. We knew we had the ruling from the Supreme Court. We weren't going to wait for a decision on that. We decided to start our campaign pretty much right away. We weren't going to wait. And the ruling did come back at the end of January saying, yeah, you cannot keep them off the ballot. You have to put them on the ballot. There's nothing you can do. So we moved ahead and went forward with that, but we weren't the only ones campaigning, of course. A group called Toledo Jobs and Growth Coalition also decided that they were going to run a campaign at this time. And about 2 weeks before the election, we started seeing a lot of materials pop up, mailers that were going out, ads that were on the radio all the time. And basically, we were painted as these extremists. We were meddlers. We were from out of town. We were going to harm everyone. We were going to come after your children. We were going to hurt your job, your business. Families were going to suffer. Churches were going to be closed down. We were just awful people. And really, this idea too that we were going to turn businesses away, we took a firm stand on that and said, yeah, you know what, if your business relies on polluting, on harming this community, on killing people here, we don't want it. And I think that's okay for us to say. And we get sort of painted as, oh, well, you can't deny what's going on. You can't deny the economy opportunity. Well, I think we can if it's going to be killing us. And that was the firm stand that we had to take. This is another image from their website, which is still up. And I love it because it's basically they're showing what they're doing and trying to make it look like that's what we're doing. We couldn't uncover who was behind this Toledo Jobs and Growth Coalition until after the election. But it turned out that they had spent $300,000 on their 2-week campaign, and it was funded almost exclusively by BP out of Houston, Texas. And they were running 2 different ads on 9 different radio stations every half hour. And so, we knew there was going to be a lot of money in this. We raised and spent just under $6,000, and that was money we raised within the community. I think our highest donation was like $100, and we won. So it was a wonderful victory to beat that amount of money. We got 61% of the vote. There's not a lot I can say to describe that moment that these really cheesy pictures don't do justice to. So, it was just a very rewarding moment. And we knew we were making history. It was such an emotional up and down battle just to get to the ballot. So it was very rewarding. Unfortunately, that victory was pretty short-lived because the very next morning, an agricultural operation decided to sue the city of Toledo, allowing for allowing its citizens to amend its own charter. And I want to make it clear that this was a corporation that sued the city of Toledo, right? It was Dravis Farms LLC. It was not Mark Dravis or an individual. It was a corporation. So a couple of things that happened throughout this. We tried to intervene in the case as the community group. We also tried to intervene as the lake itself, which was very funny when people would say, well, you're a lake, you can't bring a lawsuit. But they had no problem with a corporation bringing a lawsuit against the people. The other thing is that the state of Ohio intervened on the side of the corporation, and they were allowed to be a party in that case for the entire duration. So, you see that one-sidedness and the lack of clarity, and that it's okay for a corporation to have rights, but not an ecosystem. So unfortunately, just this year, Judge Zuhari did render his verdict, and he did overturn the Lake Erie Bill of Rights. But you read his ruling, and there's no way I can take this as us failing or losing, because he ruled that LEBOR injured the state of Ohio's permitting process, that we injured them on paper. And that was a really validating thing, because that was what we set out to take aim at. So to say you can't move forward because you're too effective, I was okay with that. And it was a good point for him to make. Now, unfortunately, by saying that we injured the state on paper, he's overlooking injury to the lake itself, to that ecosystem, to the 500,000 people who didn't have water, to the democratic process and the rights of Toledoans. None of that has standing in court. So that was very hard to sit back and witness, because you see these parties, the corporation and the state, taking a stand because they don't want to relinquish their power. It was never about having clean air, clean water, or upholding any kind of rights or democracy. And it's worth noting that in that same decision, it's also called unenforceable and deemed a value statement, and said that it's so vague there's no way it could possibly function, and would, basically it's a non-start initiative. So you have all these things in the play. There's a lot of contradictions in this, and what's clear to me is just that our courts just don't have the vision yet to accept change and to make change. It takes courage, and Judge Zuhari obviously wasn't at that point yet. So the important thing, though, is that our legal system is going to be the very last thing to fall, and it's important that we confront and challenge these barriers to local democracy head on. Even if everything tells us there's no possible way that we can succeed, and that it's unconstitutional and it's against the law and it's not right, it's those confrontations that will bring the change that we need. And the legal changes are going to be chipped away really, really slowly. But right now, the cultural changes are happening, and it's the cultural changes that fuel that fire and fuel that movement. I like to close just with this image and present a question of who's upholding the law, who's following the law, and what does that really mean when the laws are heavily skewed against people and against rights. I can look at this picture today, and because these protesters put everything on the line and took a stand at a time that was very scary, and everything in the world was telling them, don't do it, you don't have the right, you don't have the power, you're going to get hurt, all of this is going to happen. Because they did this, I don't look at this and see a gray area. I can look at this and it's clear who's right and who's wrong. And I really hope that the seeds we're planting today for rights of nature and for Lake Erie will be seen by future generations in that same clear light.
Okay, thank you very much, Marky. We have about 10 minutes left for questions. So, questions. And I'll leave Mary.
Yeah, we don't have any questions, but we've got some good comments. So I wonder if Michael Capronis and then Greg Coleridge and then Tish Odell would want to go through and speak just for a minute on what they commented about. And then Sandy, you also had something in there that you might want to share. So Michael, I don't see, can you unmute? Okay, Greg, will you go ahead?
Sure. Well, hey, tremendous presentation, Marky. I just commented, I find it somewhat humorous, darkly ironic, actually, that when you mention this whole question about the state of Ohio feeling that this is an abridgment because it's hurting the existing federal rule on paper. Well, what is a corporation but simply a artificial legal fiction creation of the state via its charter, which is submitted, has been up until recently, by paper. I mean, it's nothing but a group of pieces of paper, a document, a legal document. That's what it is. Now it may be submitted electronically these days, but irony upon ironies.
Yeah, absolutely. And it's very frustrating because it's at some point it's so clear, but it's hard for people to break their obedience to that thought of, well, I don't have the right, I don't have the power. And when you really step back and look at, well, what exactly am I being obedient to? It's like, oh my gosh, I'm following a made up set of rules that are completely arbitrary, or things that are written down on pieces of paper that I never agreed to.
And then the other thing real quick, related to the first comment, that I think CELDEF has done a tremendous job during its tenure in lifting up the undemocratic nature of corporate constitutional rights that are not political free speech rights. Can you just briefly comment on instances of that, how like the Commerce Clause or how the 14th Amendment have been usurped by or hijacked by corporations to, if you will, trump the rights of people and communities?
Yeah, I mean, in my experience is mostly just looking at what's going on in Ohio, but it's become pretty common that we can't say no to oil and gas infrastructure. We can't say yes to renewable energies, and even when renewable energies come in, if they're still industrial and corporatized, we can't say no to that either. And it becomes pretty clear when we have things like, one thing I didn't mention was in the budget bill this year in Ohio, after the deadline, the Chamber of Commerce wrote to Representative Hoops and said, hey, we know it's after the deadline, but we'd like you to slip in some language here for that says nature can't have legal standing. And that was accepted. Said, oh, sure. But when they questioned it, the reason they gave was, well, we want this because it's essential to take down the Lake Erie Bill of Rights of what happened in Toledo. So yeah, it's interesting. You can't, it's almost like it doesn't matter what's in there. If you find a loophole, they'll just create one that says, no, you can't move forward because we have the right to conduct business. We have the right to profit. We have the right to pollute. And what looks like the right to protect the economy is really the right to protect power, and it's corporate power.
Yeah, I'd like Tish to Odell to speak on that if we don't have questions, because that's really, I mean, they have the rights according to the Supreme Court, and that's the difference between Move to Men and some other organizations that are, first of all, we're a people's movement, but is they're trying to get rid of Citizens United, which, you know, not have all the money in politics. But there's that other aspect that corporations, according to the Supreme Court, for over 130 years, have said that corporations have constitutional rights according to the we the people idea. So this is all part of it. Tish, did you want to say something on it?
You're funny, Sandy. Of course, you know I always want to say something. I've been typing things in chat, and Marky, you did a great job, and thank you for letting Marky speak at your meeting today. There's so many things. I mean, it's just, I mean, again, this is the whole system that we're talking about, and I guess the whole, I don't even know where to begin. You guys know so much of this. Your group is well aware of so many of the problems. I mean, the Commerce Clause, you know, and I'm thinking they label the trash from oil and gas drilling that's toxic as commerce. You know, all our landfills, that's commerce. And the issues are much bigger, and we have to look at, I mean, what the problems are. And some of it, like this whole idea of like, I'm just picking energy, but this applies whether it's labor issues, you know, minimum wage, or whether it's election issues. But it's all about, you know, the corporations and this personhood idea. And I want to be very clear, when we talk about rights of nature, you know, and some people automatically go, well, nature should have personhood rights. You know, we have this big issue with putting humans at the top of the food chain, so to speak. And that's a huge cultural shift that we need to make. We're part of nature. And so when you give nature, like the lake, we don't want to give it personhood. Not a person. It's a living entity in its own right to live and flourish, and it has to be healthy in order for us to be healthy. The problem with giving it personhood rights is the same problem you have with giving corporations personhood rights. They are people. And so, I mean, that creates liability, right? And standing and all those things. And if you can sign contracts, all those, because those are personhood rights. Well, a lake, obviously, when it floods, are we going to allow, you know, are the people going to be able to sue the lake? You know, so that's, I mean, a clear distinction I think we want to make with rights of nature, that, and Marky touched on this, it has the right to be healthy and to flourish and thrive in its own right, not because we give it personhood rights. And so if you can do anything to help talk to other people about this, and what's interesting is I've said they let the genie out of the bottle when it passed in Toledo. They fought like hell to make sure it didn't get on the ballot, and then it didn't pass, and it did anyway. And so that's what that preemption bill, that was in May, it passed in February, May. They slipped that language in the day before the vote. Mm-hmm. People have to realize how corrupt this system is. And when we talk about who's writing the laws and for whose benefit, and again, what's legitimate laws and what's illegitimate laws, to me, that's an illegitimate law. And so that's something, like Marky said, we have to keep challenging. And I hope no one shies away from where I'm working with people now. Hopefully they're looking at something like an Ohio River Bill of Rights. We know we have that petrochemical hub going there, and the Ohio River is the most polluted river in the United States for 8 years running. I talked to groups this week along the Lake Erie lakeshore. We're facing open lake dumping of pollutants. We're facing the industrial wind, which is, the lake would be a guinea pig for that. The sewage sludge that's dumped into the lake. So there's many problems. There's a pig iron plant going on the lake shore in Ashtabula, which there's no other pig iron plants in the United States. This company's from South Africa, and they're going to put it right on Lake Erie, and it's a very polluting process. So, you know, again, maybe there'll be another try at a Lake Erie Bill of Rights. There's actually been a representative in New York who he took the language from Toledo's and has proposed it to the New York legislature. So I'll stop there, but yeah, it's a great topic, and thanks for letting us on the call.
Thank you, Tish. Thank you, everybody, for this. Again, the connections can't be more poignant. If you want, you know, all of us are probably with groups who have tried so hard to get citizen initiatives on ballots or to get some thoughts for it. We have to spend hours and, you know, thousands of hours, tens of thousands of hours on the streets doing what we need to do to get the approval of the people, go to them directly. And then when we get it, but if you're a corporation, a rich corporation, all you do is you just make a phone call and get an appointment, say, this is what I want to do. And it's unsustainable. Yes,
hey, Sandy,
yes.
I forgot to mention one quick thing, that we have a lawsuit going. It's an appeal. It's a federal civil rights lawsuit that we've brought on behalf of 8 communities who have all tried. You guys may not know either. Because of these things, they're keeping things off the ballot. Sandy's well aware in Columbus, but it's getting more and more now as the people realized their right, their constitutional right to propose law directly, direct democracy. The government's trying to shut that down, and they're trying to do it by giving the government that you're trying to alter or reform the authority to keep your initiatives off the ballot. And so that means our final right to direct democracy will be gone if we don't fight this. And so we're looking for amicus briefs. So if anybody in the group knows groups that could possibly write that to help support, because as Marky put up, they always have a ton of amicus briefs against the people, and usually the people, there's no one joining to show the court that there's lots of people that support this right to initiative. And it has nothing to do with the specifics of our initiatives, but just the right to initiative directly. So if you want information, just email me and I will get that to you. Thanks. Sorry.
Tish, can you put your email in the chat then? And anyone else who has something, go ahead and put it in the chat so people can get hold of you. I'll put my email in there too, if you have any specific questions as well. Thank you both for coming in. I want to say what's coming up, but I just, it's incredible. It's really frustrating that this is happening, but I just feel, and just very heartened by the fact that there are things that we can do. They're well thought out plans, and we have the right behind us. We have the U.S. Constitution behind us that says, yeah, we've got these rights. So, you know, we're working at it. It's a hard battle, but you know, it's gathering that critical mass, and this phone call or this Zoom conference is very much part of that, as are the conferences that you all have held. So real quick, I want to let you know about our next quarterly. We were supposed to have this in-person meeting in the spring. It would have been all day, so we've divided that 8th annual gathering for Move to Men statewide into different components. And this has been our second. And our third one will be on September 26th, 10 to 11:30 a.m. the same time. And our speakers, one will be about corporatization and the privatization of education, so charter schools, with Bill Phillis with the Ohio Coalition for Equity and Adequacy of School Funding, as well as about the corporate rules impact on rural and family farms. And our speaker there will be Ohio Farmers Union Representative Joe Logan. So 2 really good speakers and on essential topics. If you haven't joined movetoamend.org yet, you might want to go ahead, because we will send these out to you so you'll get information about them as well. We don't send out a lot, but we do want you to be informed about what's happening, the different events happening. I have marked a couple of things in there. There's also Move to Men Central Ohio has a program now about Central Ohio, but our next program concerns everybody in Ohio. And so you're welcome to come to it. Our program is called Speaking of Democracy, and it's going to be about fracking coming to Ohio State University main campus. So a lot of people in Ohio are alumni of Ohio State or know people who are. There's a concern, the state is trying to get permits, or companies trying to get permits from the state to build a fracking processing plant on the main campus of Ohio State. I live 2 blocks from it, so that away. So anyway, you might be interested in checking that out. You can look it on the Zoom, Columbus, Ohio, Move to Men Central Ohio Facebook, and we'll be posting that also. So if you're interested in joining any of these efforts, please do. This is, this is about reclaiming our rights. Well, not even reclaiming sometimes, but making sure we have our claims to healthcare rights, environmental rights, and democracy. Our rights as in a democracy, because we don't have it right now. It is, we're at the very brink of where we're not going to have it at all. So we need to really work on this and show that, the people. This is a people's movement, and we're the ones. It's very local, and we're the ones who are going to state what we should be doing, not the corporations. Any last comments? It's almost, we got 5 more minutes, so if there's any other comments, I leave it open. Greg, if you haven't already done so, sign our national petition. Yes, please do. He's got the link right there, easy peasy. I noted a petition earlier. It's with Columbus Community Bill of Rights, because we've been the same thing that Markey has, and the group over there, and what all of you've done as well in SPAN. And we try to get things passed. We met every single requirement 4 times, and or 3 times, and they won't their block edition. I'll try to put the link there again, and I'll put my email. Again, I'll leave it open to everybody.
I'll add a comment. When the shutdowns were first happening and COVID interrupted the March primary, it was our governor and other state officials who came out and said that we shouldn't have to choose between, our constitutional rights and our public health. And that needs to be the situation even beyond COVID. And I think this is great to make sure that we remind them of those words, to say that we shouldn't have to choose between those things. And essentially being able to vote on these issues and say we want to ensure public health, and we do that by having access to healthcare, by having protections for the systems that sustain us, is crucial. And we need to do that by enacting our constitutional rights. So great words to remind them of as time goes on.
Okay, so got a couple of minutes. So lastly, I just want to say thank you to everyone who participated, everybody who came on the meeting. Let this thing grow. We'll have our third one coming up, and please check on those. A special thanks to Marky and Debbie. Really, your presentations are just so full of information that's helpful and inspiring. I mean, you've done so much of the work. We need to build on what you've already done. So thank you so much for that. And that's all I have. Just thank you for everybody. And if I don't hear anything else, I'm going to close the meeting out. 11:28. I love that. So, okay, folks. Thank you very much.